Any county board members want to be paid for today?
No.
No? No? Missing anybody? Okay. Pleasure of the minutes of the November 3rd and November 8th and the November 16th.
Skip number 3.
I'm sorry?
You skipped number 3.
Oh, I'm sorry. Public comment. Anybody for public comment?
Is anybody here for public comment?
Please come to the microphone.
Hi, my name is Lynn Sharkey, and my mom was a resident of Clearview for the last 4 years. She passed away last week. I would like to acknowledge the Clearview staff for the care they gave my mom for the last 4 years, including the last 18 months of the continual COVID outbreak. I just wanted to say that I feel that vaccinations are really important for staff and residents, and I know the mandate just came out, but many of the residents are unable to wear masks for some reason or another, and many are unable to express their wants and needs, so they have to rely totally on the staff to keep them safe. My mom had dementia. She also had aphasia, which means that she was unable to verbally communicate. She was hard of hearing and she was unable to walk, so she was totally reliant on the staff. I respect the fact that those who work in the healthcare profession have a passion for helping others, providing what is necessary for the residents to be safe. Staff come in close contact with numerous residents each day while dressing, toileting, feeding, and bathing. Protecting themselves and the residents should be #1 concern. The fact is that vaccinations do help us from getting really sick, staying out of the hospital, and dying. And right now, this week in Wisconsin, Wisconsin is ranked 4th in the whole nation in COVID positivity. So vaccinations not only help keep healthcare workers safe, but they also are entrusted to their safe care with the residents. So this is an unselfish act for those who aren't able to help themselves. Thank you.
Anybody else? Okay, approval of the minutes of November 3rd, 8th, and 16th. Motion made and seconded. All in favor? Opposed? Motion carried. Voluntary and involuntary discharges.
So for our CNAs, we had one flexi, we had one full-time CNA and one part-time, or I'm sorry, 2 part-time CNAs. We had a food service worker student, one of our hospitality service aides, one full-time AM food service worker, and then one RN supervisor who was pretty much just on call. A lot of times it gets to be too much with their other jobs. And then also our assisted living program manager. And then we had one retirement, and that is another full-time food service worker on our team. So for a total of 10.
How many did you say, 10?
Yes.
Questions?
Is that something I could just get from you after the meeting again? So you don't have to repeat it, I was just gonna write it down.
Sure.
Thank you.
Okay,
Have we been able to hire any new staff?
No. We have a few that we're, checking references on and that thing, but nothing in the last few weeks.
Is it lack of applications or lack of qualified people applying, or is that?
I would say it's more lack of applications.
Is that with the bonus? That's with the bonus?
That is with the bonus. And us, posting it on Indeed and Facebook and all the things that I mentioned last month.
Okay, number 6, census reports.
All right, so in November, we averaged 82.2 for the month. Year-to-date, we're at 90.1. CBIC, stayed steady at 16.7. IID, 37. Annual average is 35.6. Behavioral health at 33, average 31.9. Northview, 16.3. Year-to-date average is 17. Trailview, 3.6. Average is 3.7. The community group home stayed steady at 3.4. Yeah, we had some we had a lot of residents move on in November. We were cautious with our admission numbers, not knowing what the outcome of the vaccine mandate would bring in terms of our staffing. So we didn't. So again, we're just being cautious. So that's pretty much it. And also the hospitals don't have a lot of elective surgeries going on still because of the higher numbers of infectious disease that they have in the buildings right now. So.
And if I can ask, when you say we're being cautious, that means there are some people who applied that we did not accept.
Yes.
Okay, so some people who needed, we did not accept. So that's unfortunate.
It
But
is.
I understand. It's really sad.
Yeah.
There's a skilled nursing facility, and there isn't another one right now. Okay, thanks.
It's kind of it's going on in the whole industry right now.
Yeah.
Okay, number 7, quality assurance, not survey report.
Hey, Dan. Want this?
Okay, so this is just a compilation of the mock surveys and state surveys that we did for 2021 for all the different households. I am Jennifer Somerton, service coordinator, corporate compliance officer.
No relation spelled differently.
What's that?
I said no relation spelled differently.
Yeah, I spell it the right way. IID mock survey and state survey results. So, in my current position as compliance officer, I did not have involvement with the mock survey for the IID household this year, so I don't actually have that file. But as far as state survey results, there was a few statements of deficiency. The hall 1 and 2 laundry room sprinkler heads were covered with lint. I did go back and check, and they are now free from lint. Statement of deficiency. The next 2 were just, as far as feeding, we need to let the residents do as much as they possibly can. So they were not allowed to pour their own fluids or serve their own foods, which is really complicated during COVID. And that's kind of what that came down to, is we didn't know how to really accomplish that without putting them at risk of, contamination, which we did come up with ways now. So that has been resolved. And we have improved the dining observation schedule to make sure that we're watching people to make sure that they are using these techniques. The other statement of deficiency, once again, with the feeding, is that we had a blind resident who was not communicated the location of the foods on the plate. So once again, that's being observed to make sure that staff are doing that. And then we had one instance where the wrong liquids were used, technically according to the care plan. The resident was capable of using both the thin and the moderately thick liquids, and so the care plan was updated to reflect that both can be used. For the nursing home mock survey, I did not have involvement with that one as well. But with state survey results, there were 3 citations. The first one was that the medications that we use in the Med Islands were not dated upon opening. The policy was provided showing that we do require that as a standard, and we did provide education for our nursing staff to make sure that they remember to do that. Another one was assistive device was not provided during mealtime. Certain residents have to use certain plates dishes, things like that, and apparently one was not available, and this was not communicated, and so a replacement was made that wasn't sufficient. So we just made sure we educated everybody to communicate if we don't have the proper utensils that we need. And then inappropriate social distancing, once again, this is at the beginning of the pandemic when everybody was kind of trying to figure things out. That what everybody was spaced appropriately while they were seated, but then when they would get up to try to walk between tables, then we weren't able to maintain that 6-foot distancing. So once again, we educated staff to make sure that they are cueing the residents to keep that 6-foot distancing. And then also just making sure that we're keeping everything spaced properly.
I just want to add a point to this one, a couple of them that are sort of COVID related. This one in particular, the guidance from the state changed the next week because these were vaccinated residents. And they changed the guidance the following week saying it's okay for them to walk in between the residents. So, you know, you're out, I
that's
could just
still-
say, it's still a it was
Yeah.
still a citation, but, you know, it's just kind of gives you an idea what ever-changing guidance with COVID has been straight through this entire
Right.
process, so.
Yeah, it's like avoiding the moving target the whole time. We're doing our best. All right, civic mock survey, that's when I started to step in as compliance officer. During the mock survey, multiple reminders were given to staff to wet hands prior to application of soap when performing hand hygiene. 2 reminders were also given at proper timing for hand hygiene after skin-to-skin contact with residents and before touching other surfaces. When the state came in, we did get 1 level D citation, which was isolated potential harm. And that was the self-reported incident where we decided to start doing a relational screening process from social services before residents are admitted so that we can better understand their relationship with their visitors, with their, you know, their people that are in charge. And that's on the position of plan of correction. So CBH 3 and 4, mock survey, resident interview had some complaints about water and room temperatures. When we followed up, they no longer complained about the room temperatures, and water temperatures were found to be within allowable range. Multiple resident care plans required a few changes as far as diagnosis, maybe diet, some treatments, vaccination status, all those things. So then we made sure that those updates were made. Recommendations were made for the RN unit managers to audit all of the psych meds to make sure those are current with the diagnosis and signed. Hand washing did not consistently meet proper duration in order of steps. Education was provided to reinforce hand hygiene standards. There was ineffective lighting, there was rust on the refrigerator, and there was some stained linens. Follow-up demonstrated that all of these were resolved in an acceptable manner. And we do have a process in place now to screen for the stained linens, and we're providing better quality linens. Resident record was found in a chart that did not belong to them, so that was corrected. Smoking care plans and safety audits were not well documented, so we did include an improved documentation process of smoking safety audits and care plans. And because of that mock survey, there were no citations, no state findings. So in conclusion, proper hand hygiene is an area that has reliably been and probably always will remain a topic in need of frequent reinforcement due to the specificity of timing, steps, and detail it requires to be effective in a healthcare setting. If anybody's ever been trained on proper hand washing technique, it's not the way people wash their hands. You know, it's very technical, and so it's difficult to maintain that all the time, which is why there's always some slide. And so we're going to keep reinforcing and keep educating and keep on that. Clearview's compliance and ethics program proves to be effective in recognizing and minimizing risk as evidenced by the mock survey findings, resulting in long-term resolution of issues of non-compliance, as well as state survey findings yielding few, if any, citations. And then I am going to welcome any questions at this time, any feedback, any recommendations to further improve our program and our performance moving forward.
We never had any survey issues of stained linens with our prior linen provider, not once.
Correct.
And so,
That's,
we might want to go back to our linen provider because now we're getting citations with the linen.
We didn't get a
provider.
citation.
That wasn't a citation, that was a
Sorry,
monetary fine.
had we had a real citation, had it been a real survey, we would have had a real citation. So I'm gonna suggest that instead of saving money, a little bit of money, that we not have stable linens coming out. So is that something?
That's, okay.
We actually, I met with the Environmental Services Department, and they are having a weekly meeting now with the linen service to make sure that their quality standards are improved.
Also, I have one other follow-up.
Sure.
And I know this is really hard. We've just had all the staff now leave in the whole food service area, and it's really sad that in the background, I think staff's being encouraged to leave, which is heartbreaking, because how are we gonna be providing, adequate care for the people who are here, right? So it's just really heartbreaking, and how do you see us being able to maintain some of these issues? When you're talking about having staff, we've lost how many food people just now in this last, how many, like we lost the manager in food and.
No, the assistant living program manager is oversees our CBRF.
But some food service folks, two. So I'm just saying, how do you see being able to do that, to maintain that with those two more folks gone? Do you know what I mean? Like how?
I can say that our existing staff really is stepping up. I mean, the people that we have definitely care, and they're feeling the stress and they're feeling the burnout, but they're putting in 110% effort, and I've seen it and I've talked to them. So as far as the people that we are maintaining, they are focused on quality, and, they do care about the residents, and so I don't find that to be a huge concern. I know timing is gonna put some pressure on that, but as far as from what I can see, they are still trying to do things the way they need to be safe.
That's really awesome to hear, and it's really sad that all that pressure is put on the remaining
Yes.
people, when this is such a critical time, and the need for care is so much higher, and yet they're being encouraged to quit, and it's just heartbreaking.
It is great to hear that they are stepping up and doing that, but they can't do that forever.
Nope.
They're going to get burned out.
Yep.
Yes.
And no matter how wonderful they are, and I know they are great, they can't run at 110% forever. That just doesn't work.
Yep, I agree. It would just really be helpful if we had community support for these folks instead of undermining them. Just community support would be really helpful.
Yeah, I think that's a good point. I mean, I've been on this committee since I came on the board, and this committee's always been interested in the care of the residents and proud of the staff that we've always had at Clearview. I appreciated the comment during the public comment part about the talk of how Clearview helped your mother, and sorry that she passed away, but I mean, it was time maybe. So anyway, that she got good care was the big thing, and that I liked in the presentation during that. And that's really the point of, I think this committee's always been concerned about the care of the residents and our staff. It's like a family. And I always appreciated that, and I have a lot of pride in Clearview. So if we're going through bad times a little bit with staff and hiring staff, I see that as an issue, and it's a problem, but I want to see us look for how we can improve that situation. And we've always had this issue of staff at Clearview, but rather than trying to tear Clearview down, like I'm hearing in some comments, I'm going to always defend Clearview. So I just wanted to make that comment.
Any other questions or comments? Okay, number 8, consider, discuss, and take action on a write-off of Clearview receivables.
I will turn this one over to Nicole.
Awesome. I'm here to ask for the approval to write off $81,770.15. I kind of broke down at the top on a couple different categories. As you can see, one account, a third of the total amount that I'm asking for is one account for one deceased resident, a Dodge County resident, who had a divestment penalty applied when they were get on Medicaid, so there essentially is nothing we could do with that. I worked with Kim's team. She recently has passed, and there's no way to obtain any funds regarding that one account.
This account has no judgment against real estate, is that correct?
Yeah, correct.
So we need to just move to approve it, correct? Do you need a motion to
We
approve
need,
this?
we need a motion to approve this, and then it does need to go to finance. So I don't know if you have any like specific questions you want to talk through.
The untimely one, did you mention what it was, how did that happen, or what?
So
where
the
did that-
untimely, the majority, what is in there is, with our billing system, we have a primary payer source, and then, as you know, with Medicare, you have like co-insurance.
Right.
So in any billing system, these managed care plans, your Advantage A's and B's, it won't automatically book the co-insurance. So it has to be reviewed when it's essentially posted. And so some of those were missed in the posting process, essentially to move it to the proper payer source to get that secondary claim out. So then once those are submitted, there's really nothing we can do on that behalf. So I would say probably half of that total was untimely.
So when we had the prior therapy provider, they actually hired a person to do authorizations for Clearview at our request. And since that person was not rehired, we wrote off $61,000 before, and now we have other untimely ones. But I noticed in the years that we had that prior hired person at our request, the contracted hired him, we haven't had these untimely. This is the first time since we've switched that provider, the provider who had hired the authorization, they were hired specifically, part of their job was to do that.
But untimely and no auth are two different.
No, I agree. But
Okay.
it said, no auth is different from an untimely auth.
Yes.
Right? So if they just don't get it done fast enough, because.
But I haven't seen any issues in that regard. I mean, the majority of this stuff still, and I can give you guys essentially if you want dates. I mean, it's old, it's prior to 20, and I can tell you we are working everything until we know it's not collectible. We just collected on a 2017 claim, a couple $1,000s on it.
The very
So-
first 61,000, that was from that transfer. That was. So this is older, is that correct?
Some of this stuff, well, I can give you specific dates if you're looking for specific dates, like, this one's,
Well, is this
18.
more than, it sounds like it's more than one.
Yes, it's all combined, correct. Here's the list, here's the stack of, and I brought, any document, if you had any specific questions, but I just want you to know, like, we're working these until I know that essentially there is nothing further we can do. I mean, we thought I would have an additional one on here that we just recently collected on. So we're working these
Is there
until
anything on there from March of 2021 going forward?
March of 21 going forward, let's see. And I can,
The 61,000 a couple months ago was from that. A couple months ago, we wrote off 61,000, because again, we had nobody in that position, because we didn't rehire them. So,
No, that wasn't from March of 21 going forward.
so the only one for March of 21 going forward are there's two accounts saying no auth on the top there for that 253.79, it's oxygen. So
all right,
we didn't get an auth for oxygen, and that's kind of just a communication between nursing and the individual getting it. They'll put them on, and then it's not communicated that we need an auth. So those are the only two from March 21 forward that is for those dates of service. So the no auth is the oxygen. Two claims,
no, okay.
two oxygen claims.
And not now, but this year, I want to go back and look at the prior 61,000, because that appeared to me to be an amount that was from an exchange. And that'll be pretty obvious by going back and reviewing what those claims are from, but I'm not going to do that now.
Okay.
One thing you probably could do, you have it by facility, but I think some of the issue is maybe to see if it's something with therapy related. Is that,
Okay,
I mean,
there's
is that
nothing on here
possible?
that's therapy related.
it's not therapy
I mean,
related?
No, one of the positions that
I
the
know,
contractor was
but
an
it-
authorization specialist, so that is what
But
I'm talking
really authorization for
about, us.
therapies, not overall authorization to the facility. That's where most of this usually happens, is between types of care and, or funding source. Excuse me, not care, it's not the therapies per se,
I don't know that position was just therapy.
probably.
We can go back and ask.
So we do have an individual that we work very closely with, that Aaron oversees, that gets the majority of the authorizations. She actually has two different team members, but one individual that, for all the long-term care individuals, that does obtain authorizations, and we work very closely with her. And the therapy director, I mean, is very good, and we have a system in place with a new therapy company. It's a approval process that goes through several different individuals before they start therapy, that we're checking in and obtaining the authorization and that sort of thing.
No, I totally understand there's a current process in
Okay.
effect. I'm not saying there's no process, okay? There's just a dip in between
Okay.
the old process and the new process, and we lost some money on that dip.
I don't believe that's correct.
That's fine, okay?
But I can certainly go back and pull that.
I'm
for
happy
you.
to look at that,
Okay.
because that wasn't my understanding.
There's no other question, motion would be in order.
I know there's, go ahead.
Move the, right, prove your write-up.
Motion made and seconded, all in favor?
Aye.
Opposed? Motion carried. Administrator's report.
Oh, nope. Okay, yes. All right, financial update. Again, as you can see, we're doing well. Again, a lot of that's kind of a function of some of our staffing issues, but financially, we're doing well. October, I believe the COVID bonus was in there, correct? Most of it got locked to that, so, you know, October wasn't as good as, you know, the other months, but we're still doing well. As you can see, we're still operating in the black. Our payroll, Nicole throws this in there, that's just giving you an idea what our total payroll is through the year. You can see the net when you're looking at the October 21st through 11/3, you can see the bump up to 504,000 in the net. That was the month that we had the COVID bonus in there.
700.
Or the gross, yeah.
Oh.
Oh, yeah, you do have the gross column in there, so that's that's, you know, it's not that it's bad, it's just, you know, that was, the COVID bonus was that we paid to the employees. That shows the number, she also has listed the number of employees on payroll at that, the number of employees that were paid, not necessarily the total number of employees, correct?
Correct.
Incentives, again, we are paying incentives to staff to pick up extra shifts so that we have adequate staff take care of the residents. So far this year, you know, a lot of it is the extra incentives that we have to pay, that we're paying to pick up weekend shifts. The vacation incentives to help cover vacation, staff taking vacation, and then the night incentive that we had paid earlier in the year when we had some concerns with the night staffing. So on the year, we paid $212,000 in incentives for extra shifts. Clearview overtime through October 12th, we're at $1,088,000, which is down. But, you know, again, that's a function of the staff.
And for your residents, right?
Yes, correct.
Right.
So our average payroll has been 323 employees. Our average gross has been about 514,000. Average incentives that we've paid per pay period has been 8,800. Our average overtime hours is 1,385. Average overtime pay is 28,573. Average weighted overtime pay has been 16,000, so you can
Gotta combine those two.
combine them for 35,000. So our average incentives, extra shifts incentive make up about 1.7% of our average gross payroll, and average overtime make up about 8.8% of our average gross payroll.
Can you just tell us what weighted overtime is again? I'm sorry.
That is.
That would be a Sarah Lindsay, great question to
Yes.
answer for you.
Thank God, Sarah's here.
Weighted average overtime is, you have to account for any additional monies that employees may get. So for example, the COVID bonus needs to be added into their, what they call their regular rate of pay. And so overtime is essentially, their straight pay, and then the weighted average is the overtime plus any additional monies that they would get.
All right, so
So you add those together and that's your true overtime dollar amount.
it's really, overtime is anything technically that's not straight pay.
Correct.
Okay, thank you.
But their straight pay gets elevated for any of these bonuses and incentives that are paid. So you have to increase the base, the straight time base.
Okay, update on the COVID.
All right, well, on August 19th, the president announced staff vaccination requirement for all nursing homes receiving Medicare Medicaid reimbursement. On September 9th, the president expanded that vaccination requirement to all healthcare providers participating in a Medicare and Medicaid program. Staff vaccination requirements will be a condition of participation in the Medicare and Medicaid programs for long-term facilities. We talked about that, so. The Centers for Medicare and Medicaid Services released the interim final rule on November 4th, and the vaccination requirement also applies to all service providers to the nursing home. Again, this was written before last night's decision came down from the Louisiana Supreme Court. All right, so what the federal COVID-19 vaccination requirement entailed is you must have a plan for vaccinating all eligible staff, which we did. Must have process for providing exemptions and accommodations for those who are exempt. We have that. We have the process for the exemptions, and we have accommodations lined up to go. Must have a process for tracking and documenting staff vaccinations. We've always had that. The first deadline, all eligible staff must receive their first dose or one dose vaccine by December 6th, which is next Monday, or they needed to have an exemption request approved. All eligible staff must receive all shots or full vaccination by January 4th, 2022. Failure to comply will result in enforcement measures, including civil monetary penalties, denial of payment up to termination from the Medicare and Medicaid program. And then we held informational meetings for all the staff on the 16th, 17th, and 18th. The committee reviewed the mandatory COVID-19 vaccination policy at the last meeting. Recommendations were made to the policy and the exemption forms. That's why I provided all of that in the packet. All service providers and vendors to Clearview were reviewed and determined the level of exposure they have inside the building and provided with either a vendor or service provider letter. Those that were deemed service providers will be required to provide an attestation that their workers meet the CMS vaccination requirement. So I provided all of that. Again, this was prior to the ruling coming down, so it was an extremely busy month for us. I will say this though, when we had the staff vaccination meetings on the 16th, 17th, and 18th, I'm a big believer in vaccines. However, there's people that have very personal feelings about that, and I could see the fear in their eyes and being put in a position of having to choose between the vaccination and their position. This wasn't a condition of employment upon hire. So, you get mixed feelings at these meetings. Aaron and I held those, and, listening to the staff talk to us about it, I mean, it's a very personal thing for people. So it was hard to tell them, this is the way it is, and if you don't get vaccinated or get an exemption, you're done working December 6th. I mean, those are very difficult conversations. So.
How did that weigh against your feeling for the, safety of the residents? How did that compare? I'm just asking.
I don't want to, they're two different things. I'm a big believer in the safety of the residents, and when you're talking about making accommodations for the safety of the residents, Aaron and Dina, we have the proper PPE to work through that. I mean, before there was a vaccine, Aaron and her team did an exceptional job, with the safety of the residents. We had any illness or death resulting from COVID vaccine is too many. However, compared to the rest of the state, we were the best, literally. I mean, the COVID bonus that Clearview received for its infection control practices was the highest in the state. So Erin and her team do a great job. Erin and Dina, I would not trade them for anybody in terms of what they did in protecting the safety of our residents throughout this entire pandemic. So it was tough. I mean,
It was tough. I mean, we still lost 8 people, which is 8 people too many. But I also appreciate the fabulous job that those folks did. I appreciate the fabulous job the staff did. I appreciate the very difficult job that you did and your administrative team did. In this last several weeks, we had a very contentious meeting last month, very difficult meeting, a lot of pushback, and you had a lot of deadlines that frankly, in a very short amount of time, you guys met all of the legal requirements that you had to meet. And I only chuckled before because the letter went out the day before the federal order came out, but you met the deadline, and that was very, very impressive. It really was. And I understand this is really, really difficult to tell people who are afraid. It'd be helpful to let people know who are afraid to help reassure them that, of the scientific facts, right? It would be helpful,
We did, and Erin and Dina provide all of the data on the vaccine, its efficacy, its safety.
yes, good.
But that doesn't change people's fears.
No, it can't.
And some people, it just boils down to a fear of needles.
Yes.
And seriously, so.
Although it seems that most of the people objecting have already had their needle shots for measles, rubella.
That's not true.
Many of them have.
Oh,
Many
You're
of them,
right, many of
it's
them have, but we
specific
have
to
some
this.
that have not. So
Yeah,
it's,
so-
they've been true to their beliefs.
Some of them.
The other thing that was part of this, the CMS, whenever they issue a rule like this, they issue guidance. They had not issued any guidance to the surveyors as to how they're to enforce this or to how we were supposed to implement this. None of that was provided to us. They said it still hadn't been provided. They said it was coming, and the deadline was, this coming Monday.
And you did a great job. You had to do a policy by yourself, and you did an excellent job doing that.
Well, that was a team effort. One thing that came out of this, though, the state had held webinars and they were discussing, the implementation of the mandate. And one of the questions that came up was, because it's not just us, it's also, it's not just county boards, but there's, when you get to the nonprofit sector, you have governing boards. And one of the questions was, okay, if you hold the meeting off-site, does everybody have to be vaccinated? They said yes. So that would mean that could run afoul of public meetings, because ours are a public meeting. Do we check the vaccine status of everybody coming into the meeting? Do we require them to wear an N95, or do we say you can't come in? Then we're running, there's a whole, Kim and I listened to the same call, and there's a whole lot of issues surrounding just that. It's one thing if you have a private board where you can provide those limits, but a lot of private boards have people on them with very strong opinions, and they may not be vaccinated. So it really wasn't completely ironed out yet. I don't know, Kim might have felt differently, but
No, it
there's
was
a
not
lot to
completely
work through, I
ironed out.
thought.
There were a lot of open issues and a lot of questions. Like Ed said, the interpretive guidance never came down. It was being promised that it'll be released,
It's very
So
hard.
we just had to follow what our best judgment was in terms of putting together a policy and the accommodations and the exemption forms, and be ready to go on December 6th.
We don't know how long this will be, but also we can use technology, because technology, as long as they have access to what's being said and heard, the public can attend via video. So, but setting that up is kind of a hassle, but
Well, I,
There's ways to do that, definitely.
Yeah.
For sure.
But-
Yeah, and, you know, definitely the board and the committees have already encountered that. We went through it for the last 18 months.
Yes.
But thankfully, we didn't, at this point, we don't have to cross that bridge. But certainly, there would be plans in place.
Yeah, I mean, this is all temporary, so we'll see what happens.
again, it could be on stay for a day, it could be on stay for 10 months, it could be shot down completely. So, I mean, it's but- to be continued, what it is. So, all right, so our progress towards the compliance with the mandate, we still had 58 of the employees following up with 58 of the remaining employees. Aaron and others were making phone calls to the staff, getting, what their plans are. 14 of those employees are under 18 and they require parental permission. 12 religious exemptions were, at least at the time I wrote this yesterday, there have been 12 religious exemptions filed. Sarah could tell me if there were more. And at the time I wrote this yesterday afternoon, 5 had been granted and there were 7 pending. Not the issue, but the EEOC requires us to have an interactive dialogue with the individuals filing these exemption requests. So that's, Sarah conducted all those. There hadn't been any medical exemptions filed. We were anticipating 4 medical deferrals. Medical deferrals can be granted for if you just recently recovered from COVID, you're not recommended to get the vaccination for a certain period of time, and then there were some others with, I believe, with pregnancy. We had 4 resignations that coincided with the first mandate deadline. However, mandate was not given as the reason, so I can't say that's specifically why they resigned. I guess now that this is on hold, if they decide that they want to rescind their resignation, then perhaps we can draw that conclusion. And then all vendor and service letter providers and attestation forms were mailed again yesterday. Last thing Jill asked me, 4:30 yesterday, are you sure you want to do this? Well, we got to meet the deadline. So, and again, what we learned through the, I could hear Aaron down the hallway, making these follow-up calls. And what we learned is some people were just waiting until the last minute to make sure this was for sure a goal and that there wasn't. So.
Can I ask, maybe you said this, did some people in anticipation of this happening get vaccinated?
Yes.
And did you say how many? And I apologize.
We'll be getting to that
Okay,
shortly.
sorry.
I don't know how many got it just because of that. Some people just got it.
Right.
Our
But I mean,
numbers
how-
are going up.
Yeah,
So.
okay.
Okay, the court challenges. Again, this was as of yesterday at 4:30 when I finished these slides. So the U.S. District Court for the Eastern District of Missouri issued a preliminary injunction halting the vaccine mandate. This injunction only applied to those 10 states. And at that time, we hadn't gotten the ruling yet, but there are 2 other federal challenges still outstanding. One in Louisiana, that was the one that came down last night, that included 14 states, but they issued an injunction that covers all 50 states, correct?
Yeah,
Or
because
I'll let her talk about that.
Well, the injunction in the Louisiana case was to enjoin the Secretary of Health and Human Services from applying the CMS rule nationwide. So whereas in the Missouri court, the order was specific to those states, in the Louisiana District Court, the order was specific to the Secretary of Health and Human Services, which means that secretary's enjoined, and it's a nationwide injunction.
All right, the Texas one only covers Texas interests, but that one has not been decided, correct? The Florida request for preliminary injunction was denied. Wisconsin has not joined any lawsuits. And at that time, CMS had not changed or paused the interim final rule. That, of course, was different after I completed the slide. So, it's just a lot of it is just stay tuned because it changes day to day. I mean, that's just the way the last 18, 19 months has been.
I don't know why we would want to join anything since the stay is in place now. I mean.
Oh, I can't speak on behalf of the Attorney General.
No, I meant for our, why would anybody join at this point if the stay is already in place? Like, what's the point? We're going to hear, right? It's obviously going to be appealed.
Yeah,
and
I'm
we're going to hear what
thinking,
happens.
so the Texas case is probably just gonna be held in abeyance.
Yes.
And Florida was already denied, but the fifth, I'm sure it's going up to the Fifth Circuit Court
Yep.
of Appeals.
Yep.
And beyond.
Yep.
Right?
I do, I agree.
So,
Yeah.
we'll see how fast track that is.
What does that mean specifically for the policy that we had discussed the last week?
It's on hold.
Done.
On stay,
Okay.
it's on hold. It's on hold, because not that it directly affects, I couldn't understand how it affected our circuit. It's not because they can tell our circuit what to do, but they're telling the head of the CMS that they can't enforce it. So if they can't enforce it for one jurisdiction, they can't enforce it for our jurisdiction. So that's how they're making it, quote, nationwide. Because I just came in here and said, how?
Right.
You went, how does that apply?
And I had to look at the Missouri, because I'm like, how do you just apply it to the litigating
Exactly.
plaintiffs?
They did it by the secretary,
Yes.
they prevented enforcement on the national level. That's how they made it by national.
Has there been any acknowledgement from the federal or state?
Again, this happened last night,
I mean-
and our meeting started at 8, so I
Yeah.
imagine there's gonna be a lot more coming out today.
You know, to say that, yes, if we acknowledge this and Monday's deadline is out. Just acknowledgement of it from a federal level.
I haven't seen it yet, but what happened when the federal court enjoined the OSHA emergency temporary standard, within a day, OSHA put up on its website, now this is, obviously different, it's not CMS, but OSHA put up on its website, we are going to suspend implementation and enforcement of our emergency temporary standard. I'm expecting that Department of Health and Human Services will do the same, or CMS will do that, but I haven't seen it yet, but that's what I'm expecting. And who knows how quickly the administration, the Biden administration is going to pursue an appeal. Maybe it doesn't happen, maybe it does, but I'm thinking that within the next day or so, we should see something on the CMS website.
I bet they appeal it within a week. I bet they do. Obviously you gotta do the briefs and everything, so.
Yeah, they probably were ready for it.
Yeah,
Something
exactly,
like this to
yes.
happen.
But as it stands today, it's at best it's paused.
Yep.
So. All right, so we received updated visitation guidance on November 12th. The nursing home visitation guidance during the COVID-19 public health emergency was updated November 12th. It's QSO 2039, the NH stands for nursing homes. Visitation is now allowed for all residents at all times. Visitors with COVID-19 symptoms or who meet the criteria for quarantine should not enter the facility. The facility should screen all who enter for visitation exclusions. We did that prior to unlocking the doors, and we continue to do that. You can no longer limit the frequency or the length of visits. Residents on quarantine or transmission-based precautions can still receive visitors. And visitors must be made aware of risk, but cannot be prevented from entering the facility. And then the visitors must adhere to the core principles of COVID-19 infection prevention, which is, hand washing, masking.
So they have to be masked.
Monitoring their symptoms, all of that, and being careful when they're walking through the hallways. But, once they're in a resident room and the door is closed, we can't interfere, so, we don't know what goes on behind the doors. So,
But the idea is that they're told they have to maintain that.
yes, we have signage and everything else.
Yeah.
They are masked,
Yes,
visitors when they're
yes,
coming?
yes.
Not N95 or anything but masked.
They are masked, yes, correct. And then if you have somebody who's on transmission-based precautions, meaning they're either positive for COVID or there's a COVID case on their household, the staff would, alert them that, that they're positive for COVID, we can supply you with an N95 mask before you go in there so we can make sure that you're safe.
Mhm. So they would be told that, is what you're saying?
Yes. Yes. All right, COVID-19 testing. The Centers for Medicare and Medicaid released new testing guidelines for nursing homes on the 10th of September. We revised the parameters for staff testing based on facilities' county level of COVID-19 transmission. Our last positive test among staff members was the 29th. Our last positive test among residents was the 30th. Clearview is considered to be an outbreak status. Dodge County has high community transmission. So when you go to the website, you'll see, this was, I pulled this yesterday, November 30th. So our community transmission is high, it's in the red. Our positivity rate is 15.35% is positivity rate in our county. The deaths over that, I guess that 7-day period is less than 10.
Does that mean it's 9?
Doesn't, I have no idea what that means, it just means it's less than 10. And there were 19 new hospital admissions. All right,
Just
so
this month, in the month, or where?
in 7 days.
7 days, okay.
It's the 7-day metrics.
19 people.
Yep. Okay, staff testing requirements. This is when your county is in blue, testing frequency of unvaccinated staff is not recommended. You don't need to test anybody. When you're at moderate, yellow, then it's once a week for unvaccinated staff. Substantial, orange, twice a week for unvaccinated staff. High, red, twice a week for unvaccinated staff. However, if, Aaron, when does it switch? Does all staff have to be tested? That's when you have a positive
When
resident?
you have a positive resident in your facility, it's outbreak status, and with outbreak status, you're testing all staff, no matter what, if you're vaccinated or unvaccinated, you're testing them twice a week, and you're testing you have to test residents anywhere between 3 to 7 days, every 3 to 7 days, whether they're vaccinated or unvaccinated. So right now, everybody's getting twice a week testing, and then all staff, no matter status, and all residents are getting tested every 3 to 7 days.
Is that because it still transmits to vaccinated people?
Well, we just want to make sure that we have everybody, I mean, we have unvaccinated
It's
residents.
too hard to
and
not
staff, so
do it, right?
Well, vaccinated staff could,
It can still
can be carriers and,
Yeah.
not even know you
and not
have
have
it.
symptoms.
Right. A lot of people.
So that's why, again, that's, Aaron and Dina did a great job protecting everybody, and hats off to them. All right, so when you're looking at, on that same website, it shows it by, that's the entire United States. So when you're looking at, what's kind of interesting is when you look at Florida, Florida has the lowest rate right now, whereas back in July, they had the highest rate in the country. Again, I don't know what, I can't say specifically what that means. All I can say is, as you're looking at it in the south, where, it's not quite as hot as it was in July and people are outdoors more, maybe that has something to do with it. But when you start talking about the endemic state of COVID-19 and being able to move to a point where it doesn't overwhelm the hospital system, and it gets to be more like the seasonal flu because we have treatments and we have testing and we have vaccines and everything else, you might start seeing, okay, the COVID shot for the southern states starts in spring and COVID shots for northern states starts in summer. It could be something like that. As you're, again, there's talk of us moving towards the endemic state because we're better able to manage the disease. So I don't know, I'm not an epidemiologist, that's just kind of my thoughts on it. But again, as you can see, this 3 months ago, this was the worst part of the country. Now it's not. Same with over here. Might have to do with the climate, how much time people are spending outdoors.
I agree with the climate. I was also told that just with the rampant spread of it, being ahead of the whole country, a lot more people started getting vaccinated in Florida. So their vaccination rates.
And actually, if you go on this website, when you look, especially like southern Florida, their vaccination rates are really high.
Yeah, they went way up. They're like, okay, everybody's talking about this, but people are dying like crazy, so people got
Northern
vaccinated.
Florida wasn't so much the case.
Pardon me?
Northern
No.
Florida wasn't as much
No.
the case. Okay, our vaccination reporting, this was what we reported on the National Health Safety Network as of 11/29. So we're at 94.5% of the residents are vaccinated. We were at 93% on the 15th. 69% of the staff is vaccinated. On the 15th of September, we were at 55%. And then 71% of the staff have received at least one dose, and we are at 58% on the 15th in September. And I know those numbers continue to go up, but this was just, when I talked to Dina on Monday, this was what she could concretely say that she has given the injections, or she is able to find on the immunization registry. Now, when you're talking about, again, you talk about vaccine hesitancy, here's, you can't see the borders real well, but this is Wisconsin. we kind of fall in the middle. We're in, we're kind of a yellow dot, but when you look at Wisconsin, you look at Metro Milwaukee, and you're looking at a lot of the counties that are even more rural than us. I mean, their vaccination rate is between 21 and 55%, which is significantly lower. And as, you know, we talked to our counterparts around the state, I mean, these areas were really concerned about staff losses with the vaccine mandate, so.
Can I ask, are these nursing homes?
Yes, these are all nursing homes.
Is that us with the 95.8? Can you move your cursor
Where?
up to the right? Up.
No, that is Hillside, I believe, I'm not positive, we're in this one, we're yellow.
We're yellow.
We're
So-
yellow closing in on light green.
So see the one that's like,
A lot of these overlap, so I don't even know if you can see ours specifically. You know, I had to shrink it enough to get it onto a slide.
yeah, do you know what I'm talking about though? The red dot Larry's pointing at? That's in Dodge County.
No, it's not, that's,
Oh,
I would say.
point Larry, yes, right there. Do you know what that is?
That one, I don't know off the top of my head. It's not us though.
95.8 would be red.
No.
Yeah.
Yeah, like I said, this is really compressed and things are on top of one another. But I just wanted to give you a sense of, as you're looking at the map and you look at, you know, there's a lot of vaccine hesitancy down in this corridor.
Yeah, because a lot of that, those are African Americans.
And I don't know specifically why, but I'm just saying.
Well, they were actually supposedly vaccinated and told they were getting up for syphilis, but they weren't. So a huge number of those folks died. So that population has a very good reason, right, to be afraid of the government having inject them with something. I'm just saying there's a real reason for a racial difference in vaccine hesitancy.
And what's the source of this? Where could I find this if I wanted to learn?
Oh, I think it's on, this one I thought was on the state website. I'd have to go back and look.
DHS website.
The DHS website, I believe, but I'd have to look. These are both either from the DHS website or the CMS website. And then here we are. This is our household COVID-19 status as of yesterday. Again, we did have the one resident test positive, so that's the isolation. And then quarantine, that was, it's from a
That's
staff person
11/29?
positive.
So that's since our last meeting.
Correct.
with positive test.
And again, it's relative to, I don't like any positives in the building, but relative to our industry, we're doing incredibly well. So again, life is relative, I guess. And then PPE, the only thing I'd like to point out is, you know, in anticipation of the vaccine mandate and exemptions and required more N95 masks, we've been bolstering our inventory of N95 masks for the staff and also for visitors that might, you know, require them to, if they're coming to visit a positive resident. But otherwise, we're maintaining a minimum 3-month supply. The supply chain on this has been very good compared to early part of the pandemic.
The face goggles, that was at 200, that's at 0. What is that? Face goggles, right down, 2 more down. There you go.
Oh, we switched to glasses, safety glasses,
Okay.
and then face shields. Some people prefer the face shields. And again, we've kind of, you know, as we go through this, we use something up, we don't buy that product anymore, you know, because it turns out the staff doesn't like it or doesn't work as well as we had hoped, so. That is all I got. But again, you know, I can't overstate it enough. Erin and her team do a tremendous job protecting the residents. I mean, I can't overstate that. So, you know, vaccine mandate or not, we do our darndest to protect the residents. And Erin and Dina and their entire team is very diligent about that. So, in terms of the mandate, it's in a holding pattern right now. So.
Was there a number, or do you know what the positivity rate is in the county? on tests?
According to
It was red.
this, we are at 15.35%
Okay.
as of yesterday.
In a week, 7 days.
That's our 7-day average, yes. So, yes.
At Hawaii, it was less than 1%.
Right, because they have all these protection periods.
Any other questions or comments?
Why is Lauren not here?
Did you say, I'm sorry, I didn't hear your answer.
Yeah, I don't know where you got that far.
Did he say where the site was, Ken? Or did you find that site?
I didn't find it, I think in that.
I can send it out to the
Committee?
committee members, yeah.
Yeah, thank you.
Will do.
Yeah, they did.
Because then we can zoom in and see.
Actually, in the CMS one, with the county positivity rate, it's interesting when you start clicking on, around the country, it shows, you get a good idea of what it's like, so.
Anything else?
Just the next meeting is the,
January 5th.
and can I just ask, were we gonna consider doing that at 8:15? Or 8:30? Is that something?
The reason I told you to leave it as it was is because I didn't know if it was gonna affect somebody else getting the room after us.
Okay. I mean, do you think?
And we didn't make a decision. I think there was discussion after the meeting.
After the meeting.
So, well, I mean, since it's technically a committee issue, I don't know that we're allowed to go in the hallway and discuss it, so that's why I'm asking.
What is the issue?
Would you have a problem if we met at 8:30?
8:30 or 8:15?
I think 8:30, Karen?
I would prefer a little later, but that's personal. I can make it. I've been making it. I'm not early, but I make it.
Yes,
So
so,
now it's your chance to change it.
well, so this is your
And
chance.
in winter, it's maybe easier.
Easier with driving.
With driving 8:30.
8:30?
Yes.
If, but I'm not trying to inconvenience anyone else. I am retired, I can be you.
I appreciate that. I'm fine with 8:30. How about you?
I'm here anyways.
8:30.
8:30? Okay.
Doesn't affect anything
You're
for us.
okay.
Staff doesn't have to show up here.
8:30 will be okay, I would think later than that.
Oh, we're done here in an hour, so that's good.
Right.
Not always the case.
Thank you.
That's the first time I was here.
All right. We're gonna focus on that.
8:30, Joe. Okay. Motion to adjourn would be in order.
So moved.
Second.
All in favor?
Aye.
Opposed?